Good afternoon, everyone. This is a joint committee session of our county's Health and Human Services Committee and Government Operations Committee. I am joined this afternoon by my colleague and friend, Councilmember Nancy Navarro, the chair of our Government Operations Committee, as well as Council members Katz and Friedson. And we are also joined by Council members Rice and Glass from the HHS Committee. We are here this afternoon to discuss Expedited Bill 3421, Personnel and Human Resources, COVID-19 vaccination requirement. And we have a number of representatives from the executive branch who will be introduced shortly in the audience. And we also have representatives from our leaders in labor who are joining us this afternoon as well. I want to say a few things up front just to sort of establish a baseline for this conversation. The first is this. We will not be voting on this matter today. We will have a work session in which we will have a productive and important dialogue with a lot of questions from my colleagues, and Ms. Wellens will be walking us through the packet, and we will be hearing comments from the executive branch and those in the audience who request to speak. Our anticipation is that after this joint committee session, as the follow-up where we will have more questions answered, we hope to then vote it out of committee and then bring it before full council, likely not before the December recess. So I just want to make sure we manage expectations. We are joined also by one of the bill's co-leads, Councilmember Reamer. Thank you for joining us, Councilmember Reamer. So let me just say a few other things as a general baseline that are going to guide me, at least, as we have this conversation. And here they are. The first is this virus we know has been absolutely devastating, not just to Montgomery County, but to our entire world. We know it's very real and it's had tragic consequences for over 1,700 residents that reside here in Montgomery County. And we as a globe have been doing everything that we can to fight against this virus and protect those among us, especially those most vulnerable. And related to that, we know the virus has not left. In fact, we are back to cases of substantial spread, which have caused us to trigger the requirement for the mask mandate once again. And we also know that the vaccination has proven to be the most effective tool and resource in fighting against the pandemic. The vaccination has worked. It has worked well, and it gives us a fighting chance to address this virus and help us ensure that we get to the other side of it. We also have to just greatly acknowledge and express our deep appreciation for all of our county employees who have stepped up over the last 2 years in ways that were unimaginable prior to the pandemic, putting themselves, particularly our first responders, at risk throughout the pandemic. And we do greatly appreciate the efforts of the executive branch and our leaders in labor and in management who have worked tirelessly to educate our entire workforce on the importance of this vaccination. And we went above and beyond to make sure that it was available to county employees prior to the general population, acknowledging the importance of the vaccination to our county employees. We've lost county employees to this terrible virus, and almost exactly a year ago, honored them by recognizing their sacrifices on behalf of all of us. And one of those employees was Lenole Dove, who was actually a member of the Department of Recreation and who I had hired, worked in the central administrative office of the rec department and made countless contributions, as all of our public servants do, tirelessly every day on behalf of all of our residents. I also want to say a few other things as a baseline as well. Sitting as the Board of Health, this council has had to make some extraordinarily difficult and complicated decisions. All of us have felt the weight of those decisions since the beginning of this pandemic, and we have taken this responsibility extraordinarily serious because it's us sitting as the Board of Health that have the ultimate responsibility in working with the executive branch to ensure the health and wellness of all of our county residents, including our employees. And so we have had to make difficult decisions all the way through, and working collaboratively with the executive branch have taken a really aggressive stance as compared to other jurisdictions across the country and enacting policies that we believe have kept our citizens safe. And we have had great results. We have among the highest vaccination rates of any jurisdiction in the country. And we also know that we have made very great strides in helping to contain the spread, especially as compared to other jurisdictions of our size. While this has been extraordinarily controversial and emotional on every conceivable level, let's acknowledge that we still have work to do in order to get on the other side of this terrible pandemic. And we do want to work collaboratively with our partners in the executive branch to ensure the safety and wellness of all of our residents. And we do acknowledge that there have been recruitment and retention issues across all county agencies, but in particular, our first responding agencies. And so, as is always the case, this council is striving to strike a reasonable balance between addressing the myriad of issues in a very complex world that we live in right now, but in a way that helps to ensure the health and wellness of all of our residents. So I look forward to this discussion and having our questions answered and seeing if we can ensure that we end up in a reasonable place, taking account all the issues and more that I just mentioned. With that, I'll turn it over to my colleague and friend, Councilmember Navarro, the chair of our Government Operations Committee, to make some opening comments as well. Councilmember Navarro.
Thank you, Chairman Albornoz, and it's good to see everybody. I really don't have much to add. I think that you have laid out the issues that are before us quite well. It is very true that we have made extraordinary progress, but we are not out of the woods yet. And I just can only say that as we are about to celebrate Thanksgiving, there's a lot to be grateful for. But there's also still, I think, a bit of trepidation in terms of understanding when we will be able to declare a state of normalcy. And a lot of conversations have been taking place nationally regarding whether that will ever be possible. And so I think that like most things that we've had to do during this pandemic, this is an issue that we're going to have to weigh pros and cons. We're going to have to think through what are some opportunities here, and also where we might be able to tweak what is contained in the bill in its original form. Because at the end of the day, we want the same thing. We just want to make sure that both our employees, but our residents who receive services from our employees continue to be safe. That is really important. It's everything when it comes to our economy, when it comes to our quality of life, when it comes to our recovery. So I look forward to the conversation, and I'm glad that this is going to be a work session, because I'm sure that there will be many things that we need to discuss. And thank you, all of you, for continuing to work collaboratively on issues of this matter.
Thank you, Chairman Navarro. Councilmember Reamer, as one of the two co-leads of this bill, I defer now to you to make some opening comments. Councilmember Reamer.
Thank you, Chair Albornoz. Thank you, Chair Navarro. I'll just very briefly say I think that employer requirements are an essential tool for this country to succeed with our vaccination campaign. And it has been a national failure, our overall vaccination rate. And it's clear that the employer requirement policy will be indispensable to get our first doses, our initial vaccinations higher than they are. And, I just think that is painfully clear. And I also really believe, as I've learned more about this, that for employees who understand and are acting consistent with best practices, to have to work in a workplace with a coworker who refuses, it puts them in a very difficult situation. And as an employer, it puts our organization in a very difficult situation to figure out how to provide services and to do it safely for employees who are not vaccinated and for the customers, our public, who wants to know that the employees that they interact with are vaccinated. So I think employees deserve to know that their coworkers have been vaccinated. I just, that is something that, speaking personally, like I would, to come into an office, to come into a shop, wherever it is, I would want to know that the individuals that I'm interacting with daily have been vaccinated. And I think we can do that. I think it is a practical, necessary policy. And national experts are saying, keep the focus on getting to the 30% of this country that is not yet vaccinated. We've got to not give up on that. And we've got our part to do here. And appreciate my colleagues' consideration of this important legislation. Thank you.
Thank you, Councilmember Reamer. I'll make one last comment before actually asking Dr. Stoddard, speaking on behalf of the executive branch, to make some opening comments as well. And just for context, the conversation we're about to have this afternoon, think about it for a second. Multiply that by conversations at the federal government level, state government level, local and municipal government level across this country. Add to that conversations in industrial countries who have the opportunity with a sufficient number of vaccinations to have requirements. And it's just it's an immensely overwhelming thought, just that right here in our county and in our community, we're having the same dialogue and discussion that's being had around the world. So it's important for us not to lose sight of that. And we're all trying to work our way through this in a way that's reasonable, and in a way that addresses the myriad of issues that we mentioned before. But with that, and before I turn it over to Ms. Wellens to walk us through the packet, Dr. Stoddard, I invite you to make some opening comments on behalf of the county executive.
Thank you very much, Chairman Albornoz and Chairwoman Navarro, and thank you, Councilmember Reamer, for the introduction as well. I think there's going to be a lot of agreement. I think there's going to be some challenges on discussion around particularly how we get to where we want to get to. I think the county executive and certainly I agree largely with the premise that we want to get as many county employees and members of our public vaccinated as possible. I think it's going to be a question around the method and the pain potentially associated with getting us to those points that we want to talk a lot more about. I think you've heard a lot, and I won't belabor any of the points that we've raised with regard to the concerns that we have, particularly in our public safety agencies, but a few select other parts of the government, drivers particularly, where we're concerned about the implications for a vaccine mandate on those programs and their ability to effectively operate with any potential losses to staffing, as many of them are already experiencing staffing, retention, and recruitment issues that you referenced, Chairman Albornoz. We do have a couple, we saw a number, and I'll wait till Ms. Wellens goes through some of the amendments that have been proposed. There are a few that we have some additional concerns about, and I'll happy to share those when we get there. The other thing I want to point out is I have invited several of the key public safety, particularly department heads, to be with us today to address some of the questions that you all may have with regard to the implications on staffing that the mandate might have, in addition to what we've already seen with the implementation of the elements of the testing program, particularly in fire rescue, that we've seen over the last several weeks, and actually have some updated information from the weekend where we began to implement the disciplinary measures associated with the vaccine or testing program that we've implemented. So there are some additional pieces of feedback there that we'll be happy to share throughout the course of this session as we get to those various points. But we very much look forward to working with the County Council to try and get to a reasonable endpoint that encourages more employees to be vaccinated while also protecting and preserving the essential services that our residents rely on. So thank you very much.
Thank you. And as we get started, I want to acknowledge all of us read, and many of us have had conversations with Mr. Wren, Mr. Buttle, and Mr. Holland. I just want to publicly thank all three of you for those conversations and for your testimony. I know you will be in the audience today, ready and willing to answer questions that the committees may have, but I appreciate you all being here this afternoon. So with that, Ms. Wellens, I'm going to turn it over to you to walk us through the packet. And we may, at various points, go out of order here because there's a lot of complex issues that we're going to try to address. Thank you, Ms. Wellens, for laying this out in a way that I think is manageable in terms of managing this conversation. And with that, I turn things over to you.
Thank you, Mr. Chair. Thank you, Chair Navarro as well, and council members. Good afternoon, everyone. So as you know, this bill would require county employees to be vaccinated, fully vaccinated against the COVID-19 against COVID-19 as a condition of employment. And accommodations to the requirement would be explicitly available for medical reasons. And I should note at the outset that although it's not explicitly in the bill, and there will be amendments related to this, but religious accommodations also are available through the federal law, through the Civil Rights Act, Title VII of the Civil Rights Act of 1964. So that will be one issue for later discussion. And as you know as well, the requirements and implementation of the bill would be expressly exempt from collective bargaining and provisions of the code related to collective bargaining as the bill is originally drafted. The first issue that staff wanted to bring to your attention was just background about what other jurisdictions are doing. And as Chair Albornoz noted, the federal government, for example, I believe today is their deadline for their employees to show proof of full vaccination. And I heard on NPR that they are anticipating about 91% of the federal employees to report full vaccination, and about 5% are requesting some type of religious or medical accommodation, and they do not anticipate impacts on public service. And I believe that they are also using sort of a more progressive discipline approach. I wanted to, with the chair's permission, I wanted to ask if Mr. Camacho and Ms. Rodriguez Hernandez might be able to give you a snapshot of the extensive research they've done regarding other jurisdictions and compliance rates in those jurisdictions, and also be available to answer questions to you. Their research memorandum is part of the staff packet. And I'll also just note for everyone at the outset that that there was an addendum to the staff packet provided on a Friday. So once we get through the issues, at the chair's discretion, through the initial packet, there are then some additional issues, and also a lot of important information provided by the executive in the addendum that was added on Friday. With that, Mr. Chair, if I can ask Mr. Camacho and Ms. Rodriguez Hernandez to share with you some of their insights.
Please.
Great. Good afternoon. So, yeah, just to kind of give you all kind of an oversight or an outline of what staff has been doing. So we began conducting jurisdictional research based on information that we found through the National Association of Counties. They have done really great work detailing county vaccine policies nationwide, and that's since grown to outline vaccination policies at the city level, at the federal level, and at the private sector level as well. So what staff did, we kind of used that at the onset to create a list of just what different jurisdictions are doing and try to discern any impacts on vaccination rates and employee discipline or resignation as a result of these vaccine mandates. So I'll just quickly go into kind of the high level findings that we kind of saw, like the patterns that have been emerging. So just to give a little bit more context, this information is constantly evolving, and myself and Ms. Rodriguez Hernandez have been attempting to kind of update the memo and the research that we've done weekly. So I may state some numbers that may be a little bit more updated. So one of the first things we found is that almost half of the jurisdictions we looked into, which are about 30, have had their vaccine mandates legally challenged. And then about half of those, including one filed by an employee at MCPS, have been dismissed or have been ruled in favor of the jurisdiction implementing the mandate. About six jurisdictions that we've seen have extended their vaccine mandate deadline. So this ranges from an extension of 15 days to an extension of about a month and a half. Also, there's about a handful of jurisdictions that we looked into that have provided monetary incentives for employees who comply or have complied with the mandate. This ranges from $200 bonuses to additional paid time off. Almost every jurisdiction that we've looked into provides exemption for religious or medical reasons. A couple have also provided exemptions for disability-related reasons. And from the memo, you can see that from the jurisdictions that we were able to find research on in terms of the percentage of employees requesting a medical or religious exemption, that range is really between 3% to 12%. But again, these numbers are constantly changing. And then in terms of the compliance rates with these vaccine mandates, again, not all counties or local jurisdictions have met their deadline. So some have a deadline of December 1st, for instance. But of the jurisdictions that we've seen, we have seen a lot of high compliance rates. So in the memo, I mentioned 10 jurisdictions. Just looking through that memo and through some of the research since Ms. Wellens published the packet, that's up to around 14 jurisdictions that have compliance rates of 89% or more. And that's not to say that the remaining 16 jurisdictions have compliance rates that are lower. They may just not have reported data or have met their deadline yet. And then I just wanted to point out a couple examples of where the mandate has had some impacts that we were able to discern through our own research. One being in Washington State, around 3% of employees have resigned, retired, or were terminated. So that's 3% of a roughly 60,000 person workforce. And that includes 127 employees from the Washington State Patrol. And then in San Francisco, there were some transit lines that were suspended because 90 employees were placed on leave for noncompliance. And also 70 police officers were placed on leave for noncompliance. So that's just some background on kind of the local and county jurisdictions that we looked into. Ms. Rodriguez-Hernandez can provide a bit more information on the private sector and the health sector, and also some local institutions within Montgomery County.
Thank you, Mr. Camacho. So as you are all well aware of, we looked into Montgomery County Public Schools, Montgomery College, and the Maryland National Park and Planning Commission as well. You all are probably well aware that they have issued their own mandate without a weekly testing option. Since the publication of the memorandum that we did in time for the packet publication deadline, Montgomery County Public Schools hit their mandate deadline on November 15th. And as of that date, we know that 93% of employees provided proof of vaccination. 264 religious exemptions were requested and 197 medical exemptions were requested. We aren't aware of the approval rate at this time, but I just want to provide that context. For the 7% that have not yet provided proof of vaccination, we do know that a majority of those are service workers. And as Mr. Camacho stated, there was a federal lawsuit filed by one employee, but it was dismissed. For Montgomery College, they met their vaccination mandate deadline by November 8th, and they have a compliance rate of 97% of their employees, with only 88 religious exemptions and about 11 of those approved, and 23 medical exemptions requested, with 9 of those approved. The state 4 employees are currently in non-compliance and have begun the progressive disciplinary action, which is outlined in what will be the updated memo, but they have a very extensive disciplinary protocol that they've outlined publicly. And they are still in the process of working with their unions to sign memorandums of agreement on the mandate. 2 of them have signed it, and they're finalizing the 3rd. With the Maryland National Park and Planning Commission, we do not have their final information on compliance rates as of right now, but we do know right now that their UFCW Local 1994 McGeo Union has filed an unfair label practice charge against MNCPPC for separating vaccinated and unvaccinated workers, placing them in different sites. So that's the local institutions. In addition, we looked into the healthcare sector, and in the memorandum, we provided a graph that shows that a majority of the healthcare sectors or hospitals, systems, depending on what unit it is, have non-compliant rates, or I should say resignation and termination rates of below 2%. So because they were one of the first sectors to implement mandates based on their line of work, we have more information on the impacts of those mandates. And as I mentioned, the termination and resignation rate for most of them, a high majority, is below 2%. And finally, looking at the private sector, we've highlighted a few, I would say, larger companies with mandates. For example, United Airlines, 90% of staff have been vaccinated, and about 593 employees are in the process of being laid off for not complying with the vaccination mandate. And sorry, I apologize. As of October 7th, 99.5% of employees are in compliance and vaccinated. We also looked at Tyson Foods. 96 of their employees are vaccinated ahead of their deadline. And you can see in the memo a few other companies as well. So we just wanted to provide an overview of the jurisdictions, county, city, state across the nation that have implemented mandates without a weekly testing option, and some additional information on local institutions, the healthcare sectors, and private companies. And we're happy to answer any questions.
Thank you. That's super helpful for context. I had a couple of questions, and colleagues, if you have questions, please text me and I'll put you in the queue. There seems to be a wide range of religious exemption policies, everything from literally just checking a box saying, you object for religious reasons, to requiring some notification or notice from your faith. In your research, and I know it's not a full sample size, but if you can, talk a little bit about that range, and if you can, from a legal perspective, and maybe Ms. Wellens, this question is for you as well, what has been more reasonable, palpable, in terms of what other jurisdictions have done, specifically with regards to the religious exemption, which we're going to be discussing in greater detail later on in the packet, but for context with what other jurisdictions have done, I'd just be curious as to your research on that.
So I don't know. I cannot speak to the level of scrutiny that has been applied to medical or religious exemptions, but it is something that we definitely could look into to kind of see if we can discern what the basis for the decisions are.
And I will say that I think a lot of the jurisdictions have not publicly stated what their criteria are for approval of, especially the religious exemptions. Anecdotally, we noticed like some of them are like, write your feelings as to why this, would be a religious exemption approval or things like that. But especially with our local institutions, we can see if we can get more information from them as well.
That'd be great. I think as a follow-up to the next work session, any other details we can provide on that. And I know Ms. Kinch is with us from the Office of the County Attorney. Ms. Kinch, thank you so much for joining us today. I guess either you or Ms. Wellens may be tag teaming this on the legal aspect of the religious exemption. Any light you can shed on that?
Happy to respond. I'm actually looking for a form that the county had worked on in order to address religious exemption requests that were made by new county employees. And in there, we do ask, it's an attestation wherein the I guess, successful candidate would have to indicate, have to explain what their sincerely held belief is and provide the names and phone numbers and contact information of individuals who could verify that. But in general, the standard for religious exemption doesn't actually require that you be a part of what one would consider an organized or a generally well-known religion. It is not as clear as I think we would like it to be. But I'm happy to work with Ms. Wellens and do additional research and see what we can come up with.
I appreciate that. Councilmember Katz has a question, and then I'll get back in the queue after that. Councilmember Katz.
Thank you very much, Mr. Vice President and Chair. My question at this point is, in the case of public safety, we have several employees that have specialized fields, and I see that the fire chief is on, and Mr. Buttle is on. What do we have a handle on how many people in the specialized fields, if we lost them because of this legislation and how we're going to work this legislation, if we lost them, what it would do to our response times for the people who are going through crisis and need us to respond immediately? Do we have any idea on what it would do?
Councilmember Katz, thank you very much. And the information is not provided to us at that level of granularity yet as to the status of a hazmat officer or the status of swiftwater rescue members or those specialties within fire rescue. It is definitely one of our concern points as a reduction of just a handful of those specialized folks would limit the daily staffing continuity for the same services moving forward. The packet, I believe, addresses one area that you were looking at is 911 call takers. And with that being in Chief Jones's shop, I'll let him address that. But it is one that we're keenly aware of and looking at. So I'll ask Mr. Buttle if he has other information to add to before Chief Jones.
Councilmember, I agree. If we lost 50 to 100 in general, I think that'd be pretty catastrophic considering some of the staffing issues that we're currently dealing with. But the fire chief is correct. It would only take a handful, maybe 5 or 6 in some cases, in a particularly subspecialty, hazmat officer, swiftwater rescue, where we'd have to do a reduction of service. So depending specifically upon what people you lose and what specialty certification they have, it could be as little as just a half dozen of folks that would significantly impact the fire and rescue service ability to provide certain specialty services.
Chief Jones.
So good afternoon. I would say Chief Goldstein has a legitimate concern in the Emergency Communications Center where we have call takers for our 911 center as well as dispatchers. And, I think that we would, I don't have the exact numbers as he noted in his specialty field, but there is a sense that we could lose anywhere up to 20 dispatcher call takers, which would be a heavy loss and heavy impact on workload from that perspective for the 911 center, which is, again, as you all know, is a 24/7 run operation. And we have employees, again, who are working extremely long hours, even as we speak now, with staffing issues that we continuously are trying to address. But I do think that this could have some significant impact on our emergency call center.
Thank you very much. I thought that could be the case, but I wanted to say it up front. Thank you very much, Mr. Vice President. I yield back to you.
Thanks. So to follow up, we know there are at least 20 call takers who are unvaccinated in the 911 call center.
We believe we have somewhere around those numbers. I'm not exactly sure if that's the true number, but we believe that we do have a number that is a percentage that could negatively impact us.
And how many 911 call takers do we have total?
I'd have to get those numbers, Mr. Albanaz, exactly. I can get that for you shortly.
Great, thank you. Back to questions related, just for context in terms of other jurisdictions, and we'll get to some of the more specifics in the packet. And I see that Councilmember Reamer is in the queue as well. I'll get to you in a minute, Councilmember Reamer. Just a couple other questions for context. So there are understandably predictions that there will be significant swaths of the workforce who will choose to quit rather than be fired, rather than have to proceed with the mandate. But I believe, as you both noted, other jurisdictions who have enacted the mandate have not seen large percentages of their employees leave their workforces. Is that correct?
Yeah, I would say that that's correct. The biggest kind of pool of employees that I saw in my research was in Washington State, which is why I pointed that out. The 3% of the roughly 60,000 employees that they have were terminated or resigned or retired. I've seen in other jurisdictions the pool be much smaller. Just to give you a few examples, in Honolulu, Hawaii, eight employees were terminated, while 90% were fully in compliance. Trying to see if I can find any other hard concrete numbers for you. In King County, Washington, 73 workers were terminated, resigned, or retired, with 95% being in compliance. But I have not come across other jurisdictions where I saw a higher number than the Washington State figure that I presented.
And our research also presents that there's an increase in vaccination rates after the implementation of the mandate, which is a positive sign in the sense that after the mandate, workers are choosing to get vaccinated so they do not face any termination or progressive disciplinary actions from their employer. In addition, we looked at New York, and less than 1% of city employees are on leave without pay as a result of non-compliance. And I think, we looked at some of the numbers I'm trying to pull out. About 34 officers out of the 35,000 were placed on unpaid leave on the 1st of November. So I think that there's an increase in the data has shown that there's an increase in vaccination rates after mandates are implemented as well. And that the number of employees actually leaving, when we say percent, it really depends on the size of the workforce and the size of the jurisdiction. So that's why it can look a lot like it could be around the same number in a lot of places, but just because of the number of the workforce is that impact effect on the percentage.
And you may not be able to answer this now, but if you could give us a range of the runway of progressive discipline as compared between jurisdictions. You mentioned it a little bit, but it'd be helpful to know what that looks like from jurisdiction to jurisdiction, and if we can correlate that to the rates of vaccination and whether there's a correlation between how long those runways are would also be really helpful. I don't know if you can answer that now, but if you need to get back to us, that's okay too.
I think we can talk about it anecdotally, just from like what we remember in the research. I know like MCPS and Montgomery College, they have similar protocols with a letter of reprimand and then unpaid leave and X amount of days until vaccination. So I think, for example, the college, there's a 3-day, I believe, I'm just trying to pull it up, 3 work days to establish compliance after the letter of reprimand. And then if they are not in compliance, then it's an additional 3 days, but that is unpaid suspension. And then after that, they are in up to a 30-day unpaid suspension. And once they become fully compliant in vaccination, they can return and that suspension will end. But they have around that length of a timeline for vaccination. Of course, it's just closed, their mandate just closed, so we haven't seen the full results of that runaway. In addition, sorry, Carlos, did you have something to add as well? No,
I think that's pretty much the structure of what we've seen. It's just like a letter of reprimand, then an employee placed on unpaid leave, and then a certain amount of time that an employee is given to show proof of vaccination before they're reinstated to the workforce. That's generally what we've seen in terms of progressive discipline. That timing that you're referring to, I would have to do more research on that, but yeah.
Okay.
And the effect of like people becoming vaccinated after being on paid leave or on, after progressive disciplinary is, again, anecdotally, we've seen some positive reactions in terms of employees getting vaccinated after getting on progressive discipline, but we'd have to provide you a better analysis of that.
Thank you. I've got a couple more questions, but I'm going to put Councilmember Reimers up, followed by Councilmember Glass, and any of my other colleagues that want to ask questions on general context, what other jurisdictions are doing, please let me know. Councilmember Reamer.
Thank you. Well, I think this conversation illustrates why we need the vaccination requirement. I mean, vaccination requirements minimize disruption. They don't cause disruption. If we've got several dozen people going into the 911 call center who are not vaccinated, they're liable to get sick at any moment. It's just a matter of time. You could have multiple call center operators going down at the same time. I mean, we've got to get them vaccinated. And the evidence from other jurisdictions is showing that only the slightest fraction of employees will, choose to resign. In fact, when you look at the numbers, there are a lot of people out right now. They're out on leave because of COVID. Like, we are already dealing with the disruption caused by unvaccinated workers who get sick. Like, we've been working through that the whole way. And the 911 call center is a great example. That's one of the most dangerous places from a COVID perspective, because you have to talk. It's like a chorus. We all remember the chorus example from early in the pandemic where one person was sick and the whole chorus got sick and several people died. That's what the 911 call center is like. You've got folks on phones and they have to talk constantly all day. They're in an enclosed environment. That's the kind of place where you really need everyone to be vaccinated. And if there are 20 individuals showing up for work every day, refusing to get vaccinated, which we don't know, but we don't know what their status is, we got to get them vaccinated. And if we can close that gap and get that to 17 of them get vaccinated, that would be a big improvement in the reliability of our 911 call center. So I really look at this from just the opposite direction. And I don't really, anyway, want to make that point here. Thanks.
Councilmember Glass, followed by Councilmember Katz.
Thank you very much, Mr. Vice President. Appreciate the conversation, and it seems that the through line here is that within private employers or even other government agencies, localities around the country, there's a 3% drop off of employees who are not getting vaccinated ultimately. And as I've been looking at this issue, there's another issue that I've come across, and I think it relates much more to the private sector, but I see that OHR Director Attila is here, and if he is here in the weight room, and there he is. Berke, good to see you. The question I have for you is that it appears that there are employers that are recognizing the additional cost associated with insuring people who are not getting vaccinated. And I'm curious if the county, in our conversations with our healthcare providers and insurance companies as we are renegotiating, has this come up? Have they questioned the number of county employees that are not vaccinated and said that premiums might increase as a result?
Thank you for the opportunity to respond to this question. It's somewhat came up because we looked at through briefings with our providers when they give us the claims data. One of the thing we saw that COVID-related expenses and then how some of the expenditures actually driven by a few individuals, like the 80-20 rule applies. The higher cost driven is coming from one or two individuals getting really sick. So what I don't have yet is the triangulation of all that information, whether that particular claim was from an employee of ours or a dependent that is on the system who is vaccinated or not vaccinated. It's not as easy to be able to get to that granular level of data. We're working on that to be able to cross-reference between our providers to get that, but you could imagine there's obviously a lot of HIPAA-related rules that we need to do that. And except for Kaiser, our plans are self-insured. So what that means is obviously we would have to be responsible for the cost. But the rule is if you're healthy, if you're vaccinated, and if you get tested, be proactive, obviously the cost would be the claims cost would be lower. I mean, I'm not going to definitely argue against that, but I can't really give you a direct causality between, but there is correlation.
Sure, and I appreciate you sharing that, because as I've been doing some research into this just really important topic, I've seen, and again, this is primarily within the private sector, recognizing we as government operate a little differently, but Delta, which I think has been mentioned, Delta, the airplane, the travel company, they have assessed that every employee of theirs who's gotten sick has cost the company $50,000 in healthcare costs. And I think it's just important that as we have this conversation, we frame it as making sure that our residents feel healthy and safe when they call on county to provide their vital services, whatever those services might be. It might be law enforcement and first line responders. It may be some other HHS or some other departments where there are interactions with the public, but then there very well might be, to be determined, as you noted, but there very well might be another actual cost associated with some of this as well. Do you know when we might figure that out, or when the healthcare companies might come back to us, or do you even anticipate them stipulating changes to our policies because of unvaccinated employees?
So number one, the timeline, I would have to definitely check with my team and then with our providers to see how is that effort is going. Do we have any information or not? And I would be more than happy to report back on that timeline, and if there's any unanticipated challenges for getting to that result. So that's number one. Number two, and I'm very familiar with Delta, and then what they did, they also not only said that this is the cost, but they said they're not going to cover anything COVID related if you're unvaccinated. So obviously we're not trying to be that heavy-handed, but private, especially some companies like airline industry, they may need to be that heavy-handed. In this case, just want to be very clear about this type of change would require negotiations across, because that's a service design change type of action. This is not a yes or no question. It's just like an awareness sharing question, that even if there's willingness on both ends, that we would need to really work hard. And this would require some sort of a rate change, rate design change that needs to go through the work group, and it wouldn't be an easy and a quick change just for information purposes. That's because there's a lot of procedures that many other people needs to be involved.
I appreciate that, and the whole point of me raising this is for the informational purpose, right? We are having a work session, we are asking questions, we are trying to figure out the best path forward to keep our residents and keep our workforce safe, but there are costs to service and not fulfilled service, and also costs that might be unintended, and that might be the cost to continue providing healthcare for unvaccinated employees. And so for this public conversation, I think it's important to get all of that onto the table. And Director, thank you very much for your responses. And with that, I yield back, Mr. Vice President.
Thank you, Councilmember Glass. Councilmember Katz.
Thank you very much, Mr. Vice President, and good conversation. And could we get the numbers, please, as to be able to compare? In the other jurisdictions, do they have as many people eligible for retirement as we do in Montgomery County in the various departments? That to me would be helpful so that we can compare what happened to them and what could happen to us, if that's possible. And if we could also, and Councilmember Reamer raised this question, I'd like to know how many people we have out right now on leave because of COVID related illnesses. And with that, I yield back to you, Mr. Vice President.
Thank you. So we'll follow up on those homework assignments. Just a couple of other questions with regards to other jurisdictions. If we could get sort of a regional picture, in addition to the 10 jurisdictions we've looked at, for just policies and practices across the country, if we can look at our immediately surrounding jurisdictions, just there's been the argument made, and I certainly understand the argument. I'm not sure I agree with it, but that somebody will just go work for another jurisdiction if they're not going to work here. So if we could get from a regional approach, acknowledging that there are a handful of employees that work in other states, but I think for measurable purposes, it'd be helpful to know where our most likely, neighboring jurisdictions, particularly those that we share a border with, where they are.
So, Councilmember Albornoz, if I can kind of just chime in, one of the reasons we didn't include so many jurisdictions kind of in our region were because we focused on COVID-19 vaccine mandate policies that did not include a testing option. So a lot of other jurisdictions like Washington, D.C., Arlington County, Fairfax, PG County, they have a get vaccinated or test policy. So that's kind of why they weren't included in this group.
Got it. Councilmember Reamer.
Just wanted to say, it's a good question about how many employees are currently impacted by COVID, and the dashboard is updated regularly. So right now, according to what I see at the county's website under employee case counts, there's 132 employees who are currently quarantined, awaiting results, or self-monitoring. So I think that is far more than we would ever expect would voluntarily leave rather than vaccinate, including 22 at the Department of Correction, which is one of the departments with the lower vaccination rate. So, there's a huge impact at corrections from unvaccinated employees who are getting COVID and or quarantining. And this is a challenge for us as an organization. We've got to reduce those numbers through vaccination.
Got it. Any other questions from my colleagues, from Ms. Rodriguez Hernandez and Mr. Camacho, just on what other jurisdictions are doing? If not, then let's move on to the next item on the packet, which is the potential impacts of employee attrition in county services. I've got a bunch of questions in this space as well, but I'll defer to you, Ms. Wellens, to lead us through this part of the packet.
Thank you very much, Mr. Vice President. On this issue, and we're at the bottom of page 2 of the staff memorandum, the issue of potential impacts on employee attrition and county services. Mr. Stoddard or Dr. Stoddard might want to speak more on this, but as you know, his testimony was that if we were to have a reduction of 3 to 5% in the workforce, that important county services to residents would be impacted, including public safety and emergency response. So I guess some questions for staff, and I believe that many of these questions have at least been touched upon already, are, the agencies most affected, which services would be reduced by how much, and whether the executive feels that providing for the religious exemption explicitly, or if there are other modifications that would lead to a reduced impact.
Dr. Stoddard.
Sure. So I think Ms. Wellens has correctly characterized it. So that I think that there's, I think there's every reason to believe that Montgomery County employees would look a lot like other employee groups across the country, and we get to 93+% reasonably speaking vaccination rate through a mandate. It's the question of where and how the other 5 to 7% where they fell out, meaning both in terms of whether they asked for and were granted waivers, I think, and the other question would be around where those 5 to 7%, if they weren't issued waivers, fell with regard to the units. What we do know is the areas that have the most unvaccinated employees are fire, rescue, police, corrections, DOT, particularly in the bus driver realm, and alcohol beverage services has a number as well, a significant number as well. And so we had those departments conduct some operational assessments of what they thought the impacts might be if they saw varying percentages of employees either decline to, put in waivers or not be granted waivers, and then obviously what the implications of them might potentially leaving, retiring, transferring, or being suspended and through the disciplinary process would be. I think what we saw is largely that fire rescue seemed to have the most potentially significant impacts. And I'll let Chief Goldstein go through this in much greater detail, but I think the current example that we provide is, as you know, we implemented testing on October 31st, and we offered a vaccine or test alternative for the IAFF. That agreement's in place for actually 2 weeks. So beginning this past weekend, we began the discipline process for what started as on 50 employees of the 250 who had not tested as of Friday, and that number has gotten down to 24 as of today. But those 24 employees are on unscheduled leave as we speak. And so that just shows you the context of a vax or test alternative. And I have no reason to believe it would be less severe. I certainly think it would be more severe in the context of a full vaccine mandate. But you can already see over the last 6 weeks, we've had, I believe, 1,079 hours of forced hold overtime in fire rescue. And we had at least a dozen forced holds, I believe, on Sunday, in part as a result of the vax or test lost employees. And I would expect we're going to have more forced holds over the coming weeks if those employees do not participate in the vax or test mandate requirement. I think we would expect, particularly in fire rescue, corrections, DOT, and ABS, that we would see some additional impacts in terms of service operations. I think the DOT drivers one is one of particular concern. I'm sure it's shared by the council because we've not been able to fully restore services and ride on as it is because of the impacts. And I would not take a significant number of drivers lost for us to have to roll back services even a bit further. I'll let Chief Goldstein chime in on there, but he also has he has strategies in place where we'll have to look at certain apparatus if we can't use force holds to keep ourselves staffed, and that obviously would have significant implications. So I'll stop and turn it over to some of the operation departments, but I think the key point is we expect the rates would be very high in Montgomery County as they have been in other places for vaccination rates with a mandate. I just think that we need to understand what what that other percent, 3, 5, 7% would look like in terms of where they fell within the different departments and programs. And as Councilmember Katz said, particularly specialty units where we have a small number to start with. So if there's a disproportional impact on those organizations, it would be hard to reduce. And I think, and on the last point, obviously, addition of a religious exemption would lessen the numbers of people potentially who are impacted. But again, it comes down to how you're using those religious exemptions. And I think what we've seen in some states, certainly Seattle was the best example to me. I do not believe that 7% of Seattle's police department has a true religious belief that eliminates their need to be vaccinated. That would be extremely unlikely, given what we know about which religions or religious beliefs discourage vaccination. And so I think largely what they've used their religious exemptions to do is to implement a mandate without enforcing it. And so it really comes down to what you view the exemption process as. If it's push as many people to be vaccinated as possible, but allow those people who are really ardent oppositionists to claim exemptions and then grant them liberally, I think then you can do a mandate and allow that to be your out path. But if you're really sincere about how you view deeply held religious beliefs and those being the right exemption, I think it would be a very narrow exemption for very few employees, depending on how you reviewed and acted on those exemptions. And so I'll turn it over to Chief Goldstein to talk a little bit about what we're seeing with the testing already and adding additional context for what I've provided already.
Chief Goldstein.
Vice President Albornoz and Earl, thank you very much. As you outlined, October 31st, Fire Rescue in conjunction with IAFF started a weekly testing program for the folks that were not reported or not vaccinated. That number at the time when we first started was roughly 30% of Fire Rescue's career work staff. And as of this morning, that number for the reported level had risen to, I believe it was 81%. So roughly 19% of Fire Rescue's career staff is unreported. The numbers demonstrate a significant amount of reporting in the first week or so of the program. Folks who had potentially only partially submitted their vaccination proof to OHR and updated that, and indeed they were classified as fully reported. That is a continuing process, as Earl outlined. November 13th was the end of our week 2 of testing, and this past weekend with the reporting criteria and then the additional 3 days to provide documentation, there were just over 24 folks who had a work status adjustment for the failure to report the weekly status. That is significant. There's been in excess of 1,000 tests completed in that period of time, and the vast majority of FRS career staff are working with us and working to support the community and ensuring the community's health and safety. I use the FRS career staff very deliberately here, as the NCVFRA, or our volunteer association in the county, is in the midst, as we speak today, basically of signing an agreement like was completed here in the last several days for a couple of the other work units, in which a similar program will be implemented for the other half of fire rescue, the volunteer component, starting in roughly about a 3-week time frame. Operationally, as Earl mentioned, there are impacts, and President Buttle touched on it earlier. MCFRS is at one of our lowest points in our staffing capability right now, as the members who sit in Public Safety Council will understand the attrition chart, one of our tools that we share with you all during budget activities. We are in the negative at this point. While that means we are below our approved complements here and now with county stats data and OLO's data before that. We know that approved complement level is a good percent of 60 or 70 positions below what we would wish the department to be based upon the net annual work hour issue, but we are below our approved complement. Just through the cycle, it's been about the lowest we've been in about 3 years, and combined with a small number of folks out for COVID at this moment, a up and down period of our injury or medically influenced duty status activities. The staffing challenges for FRS are daily and will not improve practically until our next recruit class graduates, and they do not graduate until July. So the struggles for fire rescue are present, and any bit of loss, like Jeff Buttle outlined and you all outlined, and as Earl, any bit of loss of 3 or 5%. So 1% on the career side is 12 folks. So using 35 to roughly 50 folks lost on the career side, that'll absolutely result in service adjustments. We will not be able to, as I outlined, force hold our way through this, meaning preventing people from going home at the end of their work shift to maintain the dedicated and directed number of positions on the apparatus. So to address the reduction in staffing from a mandate or a loss of personnel, we will be discussing with the executive the adjustments. We've talked about those units or example units in the past, but that is the reality of capability. The heartbeats of the organization do not have the capacity to bear that additional loss of personnel and maintain the same level of service to our 1.0 or 1.1 million residents.
Chief, thanks. So to confirm, right now as we speak, there are 24 members of the Fire and Rescue Squad who are suspended because they have refused to get tested. Is that correct?
As of the beginning of this morning, there were that number, 24 folks who had not provided documentation for week 2 testing, and as with the agreement, they were placed on their own personal sick leave. As soon as they provide proof of their testing from that week, they will be brought back to work. And that's
Have they indicated that they will?
Again, as Mr. Stoddard outlined, as the weekend started, that number was almost 3 times that, and folks overcame some of the technical problems and or reporting requirements. It is too far for me to say, Vice President Abernaz, will those 24 provide proof? Will those 24 come into compliance?
Got it. And just a couple of other context questions for me. I know breakthrough cases are happening. Even you can get this virus even if you are vaccinated, although we know you are much less likely to have severe symptoms. You're much less likely to die. You're much less likely to go to the hospital. But we know it's happening in a small percentage of cases as we've seen break through. But can you, Dr. Stoddard, what's the quarantining period for a county employee who has come into contact with somebody with the virus who is vaccinated, and what is the quarantining period for somebody who is unvaccinated?
So if you're vaccinated and you come into a close contact with somebody who has COVID-19, obviously meeting close contact definitions, 15 minutes, 6 feet or less, then you don't quarantine if you are vaccinated, and I believe it's a 10-day quarantine if you are unvaccinated.
So if you come into contact with somebody through contact tracing and you're unvaccinated, you can't work for 10 days, but if you are vaccinated, you can continue to work.
Continue to work, so, assuming you have to self-monitor and continue to monitor any symptoms, and you do not have to quarantine according to CDC guidelines.
Got it. And those employees that do have to quarantine for those 10 days, they're still paid, correct? They're just or do they have to take their own medical leave as part of those 10 days?
They're currently on administrative leave for the period of their quarantine. We didn't, and this is from the beginning of the pandemic, we didn't want them to have the discretion of using their leave or not, because we obviously did not want them in the workplace. We were telling them not to be in the workplace.
So they're being fully compensated for being unvaccinated and being able to work from home.
That's correct.
Got it. And just a couple of other questions for context, and then I'm going to ask our friends in labor to turn their cameras on because I have some background questions for them as well. Do we do contact tracing for, well, let me ask a couple other context questions. So in fire and rescue and in law enforcement and our protective service agencies, I did the fire operations program a few weeks ago, which was incredible. I believe the statistic that was given that over a third of the phone calls that are responded to from 911, and correct me if I'm wrong, Chief Goldstein, or a significant percentage, are people that would be deemed in especially vulnerable populations of at risk of being COVID. Older adults, people with disabilities, what percentage of the 911 calls that our first responders are responding to include people that are in those at-risk categories, especially at-risk categories of receiving the virus?
That's a possibility. That number's in the realm. It's not one that I have seen recently. Indeed, those are the folks that rely upon the 911 system as their medical system and or their safety net. The opportunity there is unique. A couple adjustments, if I may, Vice President Abernaz. One of the most important parts about our response is FRS's member safety precaution and personal protective equipment that we're wearing on every run, every encounter. Surgical mask, N95 where risk and necessary, isolation gowns. So our opportunity or the concern of the resident receiving an exposure to a man or woman of MCFRS is extraordinarily low. A man or woman of MCFRS who is, COVID positive is extremely rare. as we're dealing with about 50% of our work personnel who are sick, and this is across the career and volunteer perspective or realm. About 50% of our cases today are breakthrough cases, folks that are vaccinated who are either now symptomatic personally and COVID positive, or are in a level of isolation or review based upon a close contact. So the concern is broad, but as we answer the roughly 330 calls a day, as we're wearing face covers on all runs, all patient interactions, all calls in the public, we will be very, very low chance of providing exposure to a resident, and very low opportunity of the provider getting it from a resident. The other main component, as we all have stressed through our discussions with our staff, while we are very resilient public safety providers, and in times prior to this pandemic, a lot of folks would really power through and struggle through and come to work to serve the community. This is absolutely has changed our point and view on that. At the basis of the sniffles, at the basis of, light cold symptoms, we want our people to stay home, stay off, and not come to work, because those are the telltale early signs to this virus. And that is ever present through today, almost 2 years later. And as we seek out our appropriate staffing, that should be folks who are at full speed, who are not symptomatic. We have base 7 questions that are being part of our daily approach to ensure that nobody is at work who should not be at work through, their initial onset symptoms.
And Chief Goldstein, so everyone has to wear a mask, regardless of whether or not they're vaccinated or unvaccinated.
Correct. Since the very beginning of this, every provider, every call, no matter their vaccination status, should be wearing a procedural mask or surgical mask on every call. And then when we're in our moderate to high risk patients, meaning those that are sick, those that are coughing, those where we have airway interactions, meaning with the patient's airway, that's when we upgrade to the N95. So every call, be it a lacerated finger, an arm injury on the basketball court, or a person who's got flu-like symptoms, we're always in procedural mask or greater level of protection.
And if I may, Council Vice President, I think one thing to point out too, and I was just checking back and forth with Chief Bailey to make sure I had the right numbers. But so we've actually had 4 positive tests in the weeks since the vaccine or testing policy was implemented in fire rescue. 2 of those have been in the unvaccinated pool. 2 of them have been in the random testing, which is only vaccinated staff. And 3 of the 4 positives that fire rescue have had outside of the existing testing program have been amongst vaccinated members as well. And so I think to the point that Chief Goldstein has raised, the PPE is particularly important because vaccinated or not, we are seeing positive cases in the fire rescue staff at a low rate, but still at a rate. And we want to make sure that no exposure occurs from our fire rescue staff, whether they're vaccinated or not, obviously is occurring.
Got it. Councilmember Navarro has a question, then I'll get back in the queue because I have a question of our friends in labor and our OHR department. Councilmember Navarro.
Thank you, Mr. Chairman. Thank you all for being here. Dr. Stoddard, I just have a sort of macro question, I guess. We have been in very close contact since the beginning of this pandemic, working hand in hand, trying to do whatever we could, utilizing science, utilizing best practices to address this extraordinary public health challenge. And we've seen some pretty good results. And so I guess, for me and for the public and whoever is listening, can you share with us, what has been your thinking regarding this issue, right? I mean, no doubt here we are balancing public health with the very real fact, we can't dance around this, that we are facing staff shortages in some very critical areas, it's constantly the whole balancing act. This pandemic has been all about that. But I do feel the concern of, if we are to institute something like this, is it sort of either or, right? And then we have to deal with the consequences of that action. Are there ways, and we tried working with the executive, that's why we sent that letter, are there ways to incrementally be addressing this issue so we don't end up with a crisis after a crisis? And so I'm just very curious, because I feel like you have been a steady expert and you have always guided this process from the very beginning in a very surgical, targeted way. What is your overall impression, and where do you think we actually should go from here? It's an interesting challenge that is facing us right now in the county.
I appreciate your line of inquiry, Councilman Navarro, and I appreciate the respect that inherently is shown by the question. And I would say pretty candidly, if I knew that there weren't going to be any staffing concerns in any departments, I would be all for the mandate being implemented, because frankly, I think that getting people vaccinated is a key to getting us out of the pandemic. That said, not even that said, I don't want to change the point. We do have a pretty highly vaccinated employee group. I mean, we've measured, I think we talked about it in our letter response. We did utilize the state database. We couldn't get names associated with them, which is why it's not reflected. Like, we still have to do the testing because people haven't officially reported themselves. But we've used the state database with the names that we provided the state. They didn't provide us names back. They just said, of the people you provided us, these people are actually vaccinated. So we know we're over 85% have at least received one dose. And so we're talking about the places that have actually implemented a vaccine mandate getting into the 89 to 93%. So we're really talking about 5% of our employees, maybe 7% of our employees being the difference between what we're talking about now. So when I think of 5 to 7% of our employees being vaccinated versus the potential implications that we would have in these units, and obviously with my role having shifted, a couple months ago, I've become much more in tune with the staffing and recruitment challenges faced by our public safety agencies. And it certainly gives me pause, because on its surface, it seems like obviously just implement a mandate, make people get vaccinated. But when I think about, I can think about the context of, hey, what if we couldn't, what if we had to start taking apparatus off the street? And that makes me super, super nervous. So if I knew we weren't going to have that implication, I would say, go full on with the vaccine mandate, and we would deal with the consequences. I don't feel great that there would be no implications, and that's what gives me pause. And I want to make sure, part of my role in all this, and has been from the beginning as a public health advisor, I view it not just to the county executive, but to the council, to the extent that you'll listen to me, is that I'm trying to give you the best guidance possible so that there are no surprises, or we're not surprised when things happen. And so, obviously the council will act how it will act, and we will help to try and modify the policy as best we can. But I just want you all to enter this whole process eyes wide open about what the potential implications could be. And candidly, I think throughout this pandemic, if you tried to be a prognosticator of exactly what was going to happen in every scenario, you would have lost a tremendous amount of money if you're betting on it, right? And so I've given up the point of trying to say this is what I expect will happen. It's just, I think the writing, I know we'll get to a higher vaccination rate with the mandate. I don't know where the delta of people not getting vaccinated will fall exactly in our departments. I suspect, based on who I know is already heavily vaccinated and who is less vaccinated, that it would fall disproportionately in our public safety agencies, DOT, and alcohol beverage services, maybe a little bit in general services as well. I just don't know if it's 5% in those agencies and 2% in other agencies, and that works out to about 3% difference. That's a pretty problematic outcome. And if I had more confidence about where we would end up in terms of who walked away and who didn't, I'd feel a lot better about implementing the mandate, knowing that it wasn't going to have on the street impacts. I candidly don't know that we would. Furthermore, and this will be the last thing I say, is as I mentioned I drafted the letter in concert with the county executive to respond to your letter. And one of the things I want to make sure that we highlighted is we are going to do some additional education. We're working on a program where we're going to go out and actually take DOT bus drivers, pay them an hour of overtime, and talk to them face to face, answer their questions, their medical questions, address the rumors, the perceptions, because we want to make sure that we've exhausted every avenue to try and encourage people to get vaccinated as we possibly can. Because at the end of the day, people who come along willingly, it's just better than people who feel like they were forced or mandated into something, number one. And number two, they can go on and have other people, maybe change their minds too. And so I know I took a long roundabout answer to say I'm not sure. I just wanted to explain my sort of background process and thinking as going through this and trying to give you all some guidance from a public health perspective and taking off my, the fact that I'm an appointee, but that's sort of where I sit.
No, I do appreciate that because I don't consider myself to be an expert on these issues. You happen to be somebody who, was in charge of our emergency response. I mean, you are the kind of person that had to do work on scenarios, possibly emergency scenarios. How do we assess the risk? How do we assess the threat? And we're just lucky that you also happen to have a background in epidemiology and other infectious diseases. So it's kind of like the perfect combination for a situation like this. And so that's why I have always relied very heavily on your take and your advice. So do appreciate the way that you've described this conundrum, because that's what it is at this particular juncture. Thank you. Thank you, Mr. Chairman.
Thank you, Councilmember Navarro. I'd like to ask Mr. Buttle, Mr. Wren, and Mr. Holland to turn on their cameras because the next set of questions I have are for them. So I know that each of your respective organizations have done a lot of proactive work in trying to reach out to members to educate them because we all agree that vaccines are a good thing. You've said that all publicly, and all things being equal, you would prefer that all of your members receive the vaccination because there's no dispute that, of its efficacy and how important it is to all of us. So I appreciate all of your leadership there. Can you talk a little bit about, and this expands on what Dr. Stoddard just mentioned, the efforts that each of you have taken to reach out to employees, and if you can, any light you can shed on why people are continuing to hold out from your perspective? I'd be curious as to what you're hearing, and if there is anything that we can do to address those right now between 10 and 12% based on the survey analysis that are unvaccinated. So I don't know who wants to start. Maybe Mr. Buttle, if we can start with you, and then we'll go to Mr. Wren and then Mr. Holland.
Sure. Thank you, Mr. Chair. I think we've been working really hard since the public hearing to try to reduce the number of not only unreported members who haven't reported their vaccine status, but also been working hard to get those that have not been yet vaccinated to at least start their series of vaccinations. And what we've been doing in conjunction with Fire Rescue, particularly with the implementation of the testing program, has worked. Since we've implemented the testing program, we've gotten about 150 additional members that have either reported or gotten their first vaccine or in the process of going through the full vaccination process. So I think what we're doing is working. We've also found that, with the reporting system, there's been a lot of technical issues out there. So we've had some people that have had problems uploading their vaccination status. We've also had a number of individuals who have uploaded their first vaccine status, but they never went back or didn't realize they had to go back and upload the second vaccine date in order to be recognized in the system as fully vaccinated. We've been able in the last 3 weeks actually to test over 1,200 of our members, both through the mandatory testing program that is required by the Board of Public Health, and then the random testing program that we implemented as an additional measure to try to make sure that we're testing our workforce on a regular basis, both those that are vaccinated and unvaccinated. So I think the things that we are doing are working. They are moving, things together in forward progress. And I believe it was Dr. Stoddard that mentioned we were also able to do a cross-check of the state system. And although we don't know the names of the employees, don't necessarily need to, we were able to identify some additional individuals that are fully reported at the state level, but for whatever reason, they're just not being shown as fully reported. And I would just finally note that on the random testing, something that was above and beyond the mandate of the Board of Public Health for the unvaccinated or unreported, we think that's had a significant effect with encouraging employees to either make sure that their vaccine status is fully reported, or to encourage them to go ahead and get the vaccine. I will say that there are, ask the question of those that have not done it. I do believe that there is a legitimate portion of our membership that has bona fide medical reasons or conditions why it is that they cannot be vaccinated. And I also think, and this was something that I mentioned at the public hearing, that are some bona fide and legitimate religious reasons for doing so as well. And I think in my conversations that I've had with the council members, I think that everybody is now understanding that there are some legitimate and bona fide religious reasons for it as well. So I think if we were to implement those two as well, it'd be really interesting to see where it is the numbers would be at. I think they'd be just a very small handful of people that we'd be left to deal with. So I think what we're doing is working, and we have worked really cooperatively with fire rescue to get this implemented, and I think we should just keep moving in that direction and see where it leads us to.
Thank you, Mr. Buttle. Mr. Wren.
Thank you for the opportunity to be part of this conversation. I want to simply follow some of the things that President Buttle said. Our union, as you know, as all three unions are, we're working on pushing as many of our members to get vaccinated as possible. It's a daily, nonstop, 24/7 effort. And I have to say that given the effort and the cooperation we're getting from the county and the partnership from the county, we're definitely headed in the right direction. Now, you asked why are some people resisting? There's several different reasons. There's the religious issue. There's a political issue, which I don't give a lot of credit to, but it's there. And then there's the skepticism, medical skepticism issue. And that medical skepticism issue is an underlying reason that we're trying to get through, penetrate. And I believe with the effort that Dr. Stoddard just mentioned, sitting down in small groups, one-on-one if need be, with the medical skeptics, if you will, I think we can get past most of that. But I have that element in Ride On. I have very little political pushback in Ride On. It's primarily, if not exclusively, the medical skepticism. ABS, same thing, same dynamics, workforce dynamics as in Ride On. Same dynamic that we're trying to push through, get on the other side of. Look, at the end of the day, what we've always said, I know that, I know this is a significant issue. We're trying to get through a unpredicted and sometimes unmanageable pandemic. You know as well, everyone on this call knows that the loss of members were primarily in my union. So I'm extremely sensitive. And you all know that I lost a fellow leader of this union who was my right-hand person for some 30 years. I've lost family members. So no one should ever doubt the appreciation that I have of the threat of this virus. It's real. But as labor leaders, we not only have the challenge of trying to negotiate contracts and protect people's due process and so forth and so on, we also have the primary responsibility, I would say the exclusive responsibility of managing the workforce anxiety. And these folks have been through a lot. They're shell-shocked. They're exhausted. And just discussion of forcing upon them, even though it may seem like a reasonable ask to all of us on this call, just exacerbates that anxiety. And I believe that if you would give us the time to continue to work the program that we have developed with the partnership of the county executives team, and allow us to educate the medical skeptics that their fears may not be as grave as they believe, that we'll get to a point that the number is negligible. Then I will say publicly, as I've said to those who tell me I'm not doing it no matter what, well, then you may be without a job. Okay, that's kind of where I am. I want everybody to be clear on that. But, you know, give us the time to try to manage through the reasonableness of some of the resistance that we're getting faced with each and every day. But I'd like to quickly speak about a couple things. There were no comparisons in terms of vax policies within our comparable universe. Maryland jurisdictions, the state of Maryland, Northern Virginia. I'm not going to speculate on why that wasn't so, but one thing you have to understand, each union on this call represents essential services: police, fire, public safety, public health. It really doesn't matter what is going on in Wisconsin or wherever. We have to focus on our recruitment and hiring competitive playing field. Many jurisdictions are offering hiring incentives to lure experienced workers into their organizations. I'm losing people left and right to various jurisdictions: Frederick County, Howard County. Our situation in Ride-On is hitting a crisis level. We have 60 vacancies there. 52 people put in their 2-week notice. So when they're all gone, I believe by next week, we're going to be 100 drivers down. And more trips are going to get lost, missed, and overtime is going to continue to be off the charts. And the fatigue and the wear and tear on the drivers left behind is getting to an unmanageable level. Now, let me say this. WMATA doesn't have a vax or termination policy. And one of my drivers can leave tomorrow and make more money at WMATA. That's a no-brainer for them. Now, you have a packet in front of you that you'll be deliberating on soon to start depleting it right on, and hopefully we can do that together. But these are the other real-life dynamics that the labor leaders on this call and the folks that senior managers at the county have to weigh and manage as we continue to have this conversation. Thank you.
Thanks, Mr. Wren. Mr. Holland, and then Councilmember Rice is in the queue. Just a quick time check, everyone. We have several of my colleagues have a hard stop at 5 o'clock, so we will be stopping at 5 and then picking up this work session before we break for the December recess. So we're not going to get to everything today, but this has been immensely productive and helpful so far. Mr. Holland.
Yeah, I'll keep it short because I believe President Buttle and President Wren said a lot. But the first thing is you talked about what is making people resistant. Some of the other things besides religious beliefs that are probably a lot out there, or doctors' opinions, is a lot of people, or not a lot, but I know I have 100 members or so that have already had COVID and have antibodies to COVID and don't believe they need a vaccine because of that. So that's another thing, that these people have already had COVID, and that might be another reason why they are not planning on getting a vaccine. Lodge 35 has been supporting the vaccine since the beginning. Chief Jones and past President Tory Cook took a picture together to try to promote officers to get the vaccine when we had the vaccination clinic. So we have been proponent and supportive of the vaccine. We just have to navigate of how do we deal with the 10 or so percent that unfortunately are not vaccinated, and will they get vaccinated or not? But the services of this county are going to be impacted, even if we lose 3%, 4%, which is what the average seems to be nationally. That right there is at least a half a police station full of people. We just saw on for the Saturday night in Silver Spring, we were shorthanded, and we have people doing donuts in the middle of the road, and people can't get there because we're dealing with other incidents. So people in this county want their police to be present, but we're running short. We're losing 10 officers a month, and we can't afford to lose anybody else. But that's all I have to say. Thanks.
Thank you, Mr. Holland. Well, before I get to you, Councilmember Rice, just a couple comments as a follow-up to the discussion we just had. Thank you all for providing that information and background, and I think it's immensely helpful. So the bottom line is that there have been some, but there have been many more in recent months efforts to educate on some of the medical issues, that the misinformation that's out there that we're all aware of, the reluctance for whatever reason. But there, as Mr. Wren acknowledged, despite all of those efforts, there likely will be some hopefully extraordinarily small and negligible percentage of employees who, for whatever reason, are just not going to take this vaccine. And I think what we're trying to do in at least discussing a mandate, but providing some very reasonable off-ramps like medical exemptions and religious exemptions, is to get to that place where we can say with a straight face that all of our county employees are vaccinated, because we have heard from vaccinated employees directly, and frankly, in all three of your represented organizations that have said, please move forward with ensuring that we have 100% degree of confidence that the person we're working alongside of is in fact vaccinated. And the vast majority of our employees are and believe in it. So that's what makes all of this even more frustrating, and I know for you all as well. Councilmember Rice.
Well, thank you very much, Mr. Vice President and Mr. Chair, and thank you to the union partners and everybody who's spoken today. I had a great opportunity to just be able to listen to what's been said up to this point. And so I just want to recap a couple things that I think are level setting for us in terms of why this conversation is so important. We have seen since the very beginning of this pandemic that the people who are affected most by this are some of our immunocompromised, some of our folks with pre-existing conditions, oftentimes who are people of color, people who are older and of lower socioeconomic status. And those are the same ones who oftentimes, unfortunately, are the ones who end up calling our first responders. And so they are double at risk. Not only are they at risk in general, but then if someone who comes into their home to give them service is a person who is not vaccinated, and who also, isn't following the proper procedures, can unfortunately infect someone. And so my question is, for those who are unvaccinated right now, what is the procedure for them as they respond to a scene, whether it's police or fire, whether it's our ride-on bus driver operators? Are they required to wear masks? Are they required to, in dealing with their own individual coworkers, are they required to wear masks if they have not presented proof of vaccination up to this point?
So I believe Chief Goldstein has already talked about fire rescue in terms of their, regardless of vaccination status, they're required to wear personal protective equipment requisite with the encounter they're going to have, either surgical mask or in the case of anything where there's any risk of respiratory exposure, that they'll have to wear an N95, which is obviously very protective. We don't, I mean, obviously we're following, generally speaking, the mask requirements. So if it's an indoor,
Can I just stop you, Dr. Stoddard? Is that a directive from the fire chief, or is that just
so that's well, they updated their policy, and I think Chief Goldstein had to leave us at 4:30, so I would allow him to answer this question.
There he is. He's here.
Oh, he is? Oh, then I don't even need the answers. Apologies.
As Dr. Stoddard outlined, that has been implemented with our novel hazard brief, or our information flow. as we started the pandemic and remains in place today, that face covers at all times, all patient interactions, all interactions outside of the station.
Outside of the station, but not inside. So if you're there with other co-workers inside the fire station, you can be without a mask, even though you're unvaccinated or have not shown proof of vaccination.
That is currently the case.
Okay. All right. What about police?
I'll let Chief Jones go ahead.
So with the police department, first and foremost, we don't know, we never received information of exactly who is vaccinated. So there are individuals that we don't know what is their vaccination status. But what we did was we pretty much followed the county regulations on mask wearing, on all calls for service as required by county regulations. But there is no requirement that those officers have to wear those masks when they're outside, and there's no policy put in place about mask wearing from that perspective.
Mr. Wren, when it comes to our forward-facing employees, both all those who work in our healthcare type settings, not even just in healthcare facilities, but healthcare type settings, as well as our ride-on bus driver operators, is there any requirement for mask wearing if you're not vaccinated?
I believe that in most of our services where we're having direct face-to-face contact with clients, we are required to wear masks. That's my understanding.
And specifically in the bus issue, there's a federal mandate for on buses that was just extended through January 18th. Right. It was announced today, I believe.
And I know in HHS we do it, libraries we do it. I think even in ABS when we go into when we have two people in the truck, they both have to wear it. When we go into stock the stores and what have you, yes. I'm pretty sure in most of those high touch areas we do.
And I ask all that to say that, again, as we look at how to move this forward, and I really appreciate each and every one of you continuing to push employees to be vaccinated, there's a larger picture that's at play here, and is the greater safety of our community as a whole. I do certainly understand and respect people's individual freedoms. And because of that, I certainly understand if a person would choose to not be vaccinated and then therefore not be aligned with a particular career pathway because it would require them to do so. But I would say this, that I think that there's a way in which we can ensure the safety of individuals without forcing people to lose their livelihoods and at the same time maintaining the safety of individuals. And I hope that we can get to that place. And it sounds like we're trying to get there. It sounds like all of you are continuously working together to try and make that happen. I did just want to, as we spent so much time talking about individuals and individual religious freedoms and their rights, I also just want to remind us of the individuals who are hoping to have people who are responding to help them and their rights as well and their expectations. They expect to have someone that's there to help them and not there that could unfortunately make their life condition even tougher or more difficult. And I know no one has to remind me that just because you're vaccinated doesn't mean that you can't pass on the disease. But that's one in which I do think that it would be incredibly important for us to think about mask requirement in general for folks. And it seems as though we've done that for the most part, but it seems like it may be something that may be tightened up. And especially when it comes to other employees, especially when in firehouses or police stations, things of that nature, other individuals in terms of them being protected so that we can keep our police force safe is incredibly important, right? It sounds to me like we can't afford to lose a single person. And so that happens not only from threatening a person's job, but it also means that we can't afford to lose a person from being sick, from being out with COVID also. So it kind of cuts both ways. So we need to try and make sure we're instituting whatever procedures we can to ensure that happens. And so I just want to close with just saying thank you, because I think that, again, it sounds like we're getting there. And I think with the continued collaboration and conversations, we can get to a place where we achieve that level of safety that we're talking about, and making sure that both for our employees as well as the constituents that they're serving, that we have that as tantamount when it comes to safety and protection. So thank you, Mr. Vice Chair.
Councilmember Rice, I would also add, and I included this in the letter back to Chairs Albornoz and Navarro, that the OSHA requirement does, the OSHA standard that was released and has now been, enforcement has been suspended on that, originally had a requirement for unvaccinated employees to wear masks indoors. And I would expect that once the legal challenges to that are addressed, it will include that as well. County's already expressed its obvious intent to be compliant with the OSHA standard before the enforcement goes into effect. And so that would address the concerns more largely from what you raised as well. And so obviously we've been working on getting this testing program up and running in all of the across the government, but we'll certainly be having those conversations with our partners from the union with regard to the OSHA requirement that people wear masks while unvaccinated, and we'll have to address the concerns that I'm sure that they'll have with regard to enforcement there. But obviously the OSHA standard is what it is, and assuming it survives legal challenge, that will be there as well.
Thank you, Dr. Stoddard. Back to you, Mr. President.
Director Talley is on the line. I know she wanted to get in on the last conversation, and thank you so much for joining us, Director Talley. Please.
Yes, good afternoon. I was just going to provide Councilmember Rice with our mask mandate policy. Everyone who enters the correctional facility is provided with a KN95 mask, and our inmate population is provided with surgical masks. You're only allowed to take your mask off if you're working in an office by yourself, like I am right now. So based on the unknowns, we have always done the extra protective mask because of our close working conditions and environments.
Yep. Thank you, Director. Oh, go ahead, Brent.
Yeah, let me take this opportunity to publicly commend Director Talley. She's been a great partner in trying to manage, as you could imagine, a very difficult environment at the detention centers. But we've managed to get through it.
Thank you so much.
You're welcome.
Great. Thank you for those comments. So it's 4:47, and we haven't gotten to the religious exemption section. I think it would be wise for us to pause here rather than just start that conversation for a few minutes. And so, Ms. Mullins, if we could pick up the conversation from the religious exemption section in our next work session, and we will work with you on scheduling that as soon as possible, especially while all of this information is fresh in our head as we have this conversation. But I guess let me just wrap up with a couple of thoughts. This has been very helpful, and this is all about managing risk, and there's risk on all sides. And so we're trying to figure out the best way to do that, as everyone has acknowledged. And I think that there is a light at the end of the tunnel here, and a lot of consensus around, there's a lot more agreement, frankly, in my opinion, than there is disagreement. And so I think as we go through at least one more work session, we may not all agree with the absolute end product, nor likely will we. But I think we'll get much closer than we are right now, taking all of these other issues into account. So thank you all very much for joining us this afternoon, and stay tuned for the follow-up work session of both committees. But I thank everyone for being with us this afternoon. And with that, Chair Navarro, was there anything you wanted to add as we wrap up?
No, I think you said it very well. I appreciate everybody's concern as well as willingness to find a way forward. And as you said, we will retake this. And meanwhile, have a happy Thanksgiving and stay safe.
Thanks, everybody. We'll see you soon.
To the I-270 spur.